Hello and welcome back to COVID-19 updates. In today's video, I will be discussing will universities be exempt from the new rules, and also some other questions. The government has announced new restrictions on people meeting up in England, which will come into force on Monday. Here are some of your questions about how the new rules will work. So, new rules for England. Will universities also be exempt from the new gatherings rule, as well as schools and workplaces? How will subjects such as art be taught? The new ban on meetups of more than 6 will not apply if the gathering is for work or education purposes. Workplaces and schools have been specifically listed as exemptions, and it seems likely that university seminars and lectures will also be exempt, as long as students do not sit together in more than groups of 6. But the guidance will apply to other aspects of university life, such as bars and social events held on campus. Teaching this term was already designed to be socially distanced wherever possible, with staff keeping at least 1 metre away from students regardless of what subject was being taught. Is religious worship, without social gathering afterwards, for more than 6 still allowed from Monday? While people will not be allowed to meet up in groups of more than 6, indoor public venues are currently allowed to host more than one group at a time, provided the groups are socially distanced. This includes places like pubs, restaurants, and places of worship. With more detail on the new rules will be set out shortly. The Archbishop of Canterbury, Justin Welby, tweeted, "After contact with government, we hear there is no change to guidance on places of worship. Worship is the word of God, not a social gathering, and gives the strength to love and serve." What does the government have delayed? Why does the government have delayed start dates for precautions? Why not instantly? Official rules and guidance have been updated regularly during the pandemic, and the government sometimes gives notice of changes days or weeks before they come into effect. Decisions may be taken swiftly based on the latest scientific or health advice. The government then needs time to flesh out the details of how the change will work in practice, what the exceptions might be, and how it will be enforced. It may also need to discuss changes with other UK nations and give government departments and any affected businesses and venues time to prepare and adjust to the new rules. I have a child's party organised for the 30 people we thought were allowed. Can it still go ahead? It is in a village hall. Unfortunately, the answer is probably not. The guidance until the 14th of September is that no more than 2 households should meet up indoors, though the police did not have the powers to break up a group of 30 people or less. Under the new rules, people are not supposed to meet up in groups bigger than 6, bar specific exemptions such as schools and workplaces. Parties with more than 6 guests are not exempt, even if they were organised long before the rules were changed. So they were about the new rules for England in general. Back to school. Is it a good idea to send children back to school if they have a heart problem? People who have a serious heart condition are more vulnerable to coronavirus. Many children with heart conditions will, until recently, have been shielding to protect themselves. Experts are now looking into whether as many children will need to shield in the future, given the reduced level of risk posed to children. Across the UK, children who have been shielding are expected to return to school. However, if a child has an extremely serious condition, your doctor can advise otherwise, and parents should engage with the child's school about the best way to continue their studies. If there is an increase in cases in an area, a local lockdown is enforced. It is important to check what that means for children with health conditions who are allowed to return to school. Return to school is mandatory from next week in England, but what happens for children who are in quarantine due to travel to France? Government guidance says if you are arriving to the UK from a non-exempt country, you must self-isolate for 14 days. This means you cannot go to school, work, or any public places, except in some very limited circumstances. The government makes clear that parents should consider this when booking or going on holiday. However, if you are quarantining, it would be considered as following public health guidance and would therefore make it unlikely you would be fined for missing school. I am a deaf teacher of the deaf and also have a deaf daughter. and I'm extremely concerned about how the 50,000 deaf children in schools across the UK will be able to access education if masks are worn in schools, as they will be unable to lip read. Secondary school pupils in Scotland, Northern Ireland, and those areas of England in local lockdown will have to wear face coverings in communal areas from the 31st of August or the 1st of September in England. This has already passed. Head teachers in any secondary school in England will also have the discretion to introduce them. The widespread adoption of face coverings has been a cause of worry to deaf people. Ian Noon of the National Deaf Children's Society has warned of loneliness and isolation being a tragic result of their introduction if schools and colleges can't meet deaf pupils' needs. The government stresses that face coverings will not be used during lessons. The Department for Education, the DfE, says face coverings can have a negative impact on learning and teaching, and so their use in classrooms should be avoided. In its guidelines, the DfE also says people should be exempt from wearing face coverings if they're communicating with anyone who relies on lip reading, clear sound, or facial expression to communicate, adding, "We would expect teachers and other staff to be sensitive to those needs." Would it be a good idea for random COVID testing to take place in schools? The question of whether pupils and teachers should be tested for COVID remains a matter of debate among politicians and scientists. In a report for the Royal Society's Delve Initiative, scientific researchers called for regular testing of teachers and secondary school pupils whether or not they were showing symptoms of the virus. The Children's Commissioner for England, Anne Longfield, has also called for weekly tests for staff and pupils. However, other scientists have questions whether regular testing would have much point in areas where infection rates are low. The Schools Minister, Nick Gibb, has said the government has no plans for general testing in schools. The advice that we have is that it's better to test when people actually show symptoms. I know it's a long way off, but those children that have been off school for 6 months yet are due to take exams next summer. I think will have the largest negative impact. Is it going to be looked at all? It's very likely that next year's students will be impacted by this year's results. Currently, the assumption is that students will sit exams in 2021. However, there have been some adaptations made to assessments and content. For example, students will be allowed to drop certain subjects to make it easier for students to cover the whole course. When they say subjects, as in topics within subjects, not subjects as a whole. If repeatedly touching a mask can render it ineffectual and more likely to transfer infection, how will this work with school children taking masks on and off during the school day? Schools have been issued guidance on how to ensure face coverings are removed safely. Pupils are to be instructed by staff not to touch in front of their face covering during use or when removing it. They are also encouraged to wash or sanitize their hands after removing masks. If pupils have disposable masks, they should put them in a covered bin, or if they have reusable masks, they should be stored in a plastic bag until they're reused. These questions, the next questions, are all generally just about the coronavirus, basically in general. So what is the coronavirus? The coronavirus is an infectious disease covered in China in December 2019. Its more precise name is COVID-19. There are actually hundreds of coronaviruses, most of which circulate among animals, including pigs, camels, bats and cats, but there are a few such as COVID-19 that infect humans. The 19's for the year 2019, by the way. It's not the 19th coronavirus. Some coronaviruses cause mild to moderate illnesses, such as the common cold. COVID-19 is among those that can lead to more serious illnesses, such as pneumonia. Most infected people will only have mild symptoms, perhaps a fever, aching limbs, a cough, and a loss of taste or smell, and will recover without special treatment. So basically, the key symptoms are a high temperature, cough, and breathing difficulties. But some older people and those with underlying medical problems, such as heart disease, diabetes, or cancer, are at greater risk of becoming seriously unwell. The NHS has more about the specific symptoms. Once you've had coronavirus, will you then be immune? When people recover from an infection, their body is left with some memory of how to fight it. They should then encounter again. This immunity is not always long-lasting or totally efficient, however, and can increase over time. It is unclear, though, if people who have recovered from coronavirus will be able to get it again. Hong Kong scientists have reported their first case of a man who was reinfected with coronavirus, although the World Health Organization has warned against jumping to conclusions on the basis of one case. Universities of Oxford's Professor Sarah Gilbert, who was working on creating a vaccine for COVID-19, says that it is probably likely that an infected person will be able to be reinfected in the future. What is the incubation period for the coronavirus? Scientists have said that the incubation period, the time between catching the virus and starting to show symptoms, is 5 days on average. However, some people can have symptoms earlier. The World Health Organization, the WHO, advises that the incubation period can last up to 14 days, but some researchers say that it may be up to 24 days. That's quite a while. Knowing and understanding the incubation period is very important. It allows doctors and health authorities to introduce more effective ways to control the spread of the virus. Is coronavirus more infectious than flu? Both viruses are highly contagious. On average, it's thought that people with the coronavirus infect 2 to 3 other people, while those with flu pass it on to about 1 other person. There are simple steps that you can take to stop the spread of flu and coronavirus. Wash your hands often with soap and water. If you have returned from holiday abroad and have to self-isolate in quarantine, you will not automatically qualify for statutory sick pay, the SSP, so it's possible you might have to make arrangements with your employer if you cannot work from home. Catch coughs and sneezes in a tissue and then put it in a bin. How long can you be ill? 4 out of 5 people, COVID-19, will be a mild disease a bit like flu. For 4 out of 5 people, COVID-19 will be a mild disease a bit like flu. Symptoms will include a fever, a dry cough, or loss of smell and taste. If the virus gets well established in the lungs, it can cause breathing difficulties and pneumonia. About 1 in 7 people may need hospital treatment. Recovery time will depend on how sick you become in the first place. Some people shrug off the illness quickly, but for others, the path to full health can take months and leave lasting problems. Asymptomatic people are regarded as silent spreaders. What proportion of the population are estimated to be, and how do you find them? The subject of ongoing research, but little is still known about how many people are carrying the virus without knowing it. Different studies currently suggest a huge range of possibilities for how many silent spreaders there are, ranging from 5% to 80% of cases. That was the conclusion of an analysis by Professor Carl Hennigan of the University of Oxford and colleagues who looked at 21 research projects. The upshot, they said, was that there is not a single reliable study to determine the number of asymptomatics, and they said that if the screening for COVID-19 is only carried out on people with symptoms, which has been the main focus of UK testing policy, then cases will be missed, perhaps a lot of cases. Some scientists believe that asymptomatic cases may be the main force driving the pandemic, and there has been cause for increased testing to establish how many silent carriers there may be. Why are diabetics not included in the clinically extremely vulnerable patients, and will the list be refreshed? Diabetics are not included in the list of people at highest risk. However, some people may be advised to take extra precautions if they suffer from a combination of factors such as heart disease or obesity, as well as diabetes, which put them at much higher risk of complications. A third of virus deaths in England from the 1st of March to the 11th of May were linked to diabetes, but research suggests the threat for those under 40 with type 1, insulin dependent, or type 2 diabetes is very low. Age remains the strongest risk factor for becoming severely or fatally ill with coronavirus, says experts. Diabetes UK advises anyone with diabetes to try their best to manage their condition carefully, keeping their blood sugar in range as much as possible, as well as following social distancing measures. How dangerous is coronavirus for people with asthma? Asthma UK's advice is to keep taking your daily preventer inhaler, which is usually brown, as prescribed. This will help cut the risk of an asthma attack being triggered by any respiratory virus, including coronavirus. You should carry your blue reliever inhaler with you every day, in case you feel your asthma symptoms flaring up. If your asthma is getting worse, there is a risk you might have coronavirus, and you should contact the NHS National Health Service, 111 Health Service, NHS 111 Coronavirus Service, the 111 Coronavirus Service. Are otherwise healthy disabled people more at risk from coronavirus? Coronavirus can be more severe in older people and those with pre-existing conditions such as heart and lung disease or diabetes. There is no evidence that disabled people who are otherwise healthy and who don't, for instance, have respiratory problems are at greater risk from coronavirus. Will people who've had pneumonia experience milder coronavirus symptoms? COVID-19 can, in a small number of cases, lead to pneumonia, most notably in people with pre-existing lung conditions. But as this is a new virus, no one will have any immunity to it, whether they have previously had pneumonia or any other form of coronavirus such as SARS. With key workers wearing some sort of mask, how are deaf people who lip read supposed to understand what is being said? We had a similar question like this earlier, but I'm going to answer this as best as I can. Wearing masks presents major challenges for some deaf people who are relying on lip reading to communicate, but who also need to stay safe from catching the virus, especially if it is in a hospital setting. The charity Action on Hearing Loss says there are some clinically approved see-through covered face masks that help enable lip reading. However, they do not provide enough protection against aerosols spread by coronavirus and wouldn't be right for health and social care workers to use during the pandemic. They say it might be worth using a small whiteboard to communicate. There are also some subtitling or captioning apps that may provide some help. The next section is on vaccines and treatment. Would a vaccine be 100% safe? I am worried that a vaccine may be rushed out and there may be unwanted side effects. New vaccines undergo rigorous safety checks before they can be recommended for widespread use. Although research into a coronavirus vaccine is currently happening at rapid pace, these checks are still happening in clinical trials. Any treatment can have some side effects, and vaccines are no different. The most common side effects of vaccines are typically mild and can include swelling or redness to the skin where the jab is given. Will people who have had transplants be able to take the vaccine? Scientists are testing lots of different potential coronavirus vaccines. It is not yet clear which ones may be the most effective, if any. Different versions may be more suitable for some people than others. Tests are happening in volunteers, but it may take time to get results and to know who might benefit from vaccination. If you have received a transplant and are taking immunosuppressant drugs to prevent rejection, some vaccines, such as live vaccines containing weakened bacteria or viruses, may not be appropriate for you. Would this vaccine still be effective if the virus mutates? The coronavirus vaccines being developed at the moment are based on the viral strain currently circulating. Viruses can mutate, but this will not necessarily make the corresponding vaccine less effective. It depends on how significant the mutations are and whether they affect the part of the virus the vaccines are designed to safely mimic. Many of the experimental coronavirus jabs currently being tested contain the genetic instructions for the surface spike protein that coronavirus uses to attach to and infect human cells. Reassuringly, scientists have not yet seen any substantial mutations to this part of the virus, yet that would render these vaccines useless. The next section is called Protecting Myself and Others. What should I do if I live with someone who is self-isolating? If you are living with someone who's self-isolating, you should keep all contact to a minimum, and if possible, not be in the same room together. The person self-isolating should stay in a well-ventilated room with a window that can be opened and keep away from other people in the house. If you live with someone who has symptoms, you'll also need to self-isolate for 14 days from the day their symptoms started. This is how long it can take for symptoms to appear. If you get symptoms, self-isolate for 10 days from when your symptoms start, even if it means you're self-isolating for longer than 14 days. If you do not get symptoms, you can stop self-isolating after 14 days. Should people stop having sex? If you live with your partner, they count as being part of your household. If neither of you is showing coronavirus symptoms and you are already in close contact, having sex won't increase the likelihood of you catching the virus from one another. If one person does have symptoms, they should be self-isolating in a separate room. Me and my family. I am 5 months pregnant and want to understand the risks to the baby if I get infected. Pregnant women are being advised by the UK to stay at home and keep contact with others to a minimum. However, they should attend antenatal clinics as normal. There is no evidence to suggest that pregnant women are more likely to get coronavirus, but for a small number of women, being pregnant may change the way their body deals with a severe viral infection. The government's chief medical advisor says this is a precautionary measure until scientists find out more about the virus and that the infections and pregnancy are not a good combination in general. I am breastfeeding my 5-month-old baby. What should I do if I get coronavirus? Mothers pass on protection from infection to their babies through their breast milk. If your body is producing antibodies to fight the infection, they would be passed on through breastfeeding. Breastfeeding mums should follow the same advice as anyone else over reducing risk. Cover your mouth when you sneeze and cough, throw away used tissues straight away, and wash hands frequently, while trying to avoid touching your eyes, nose or mouth with unwashed hands. Is it possible to catch coronavirus from a pet, dog or cat? This is highly unlikely to happen according to scientists and vets. While there are rare cases where an animal has caught the virus from a human, there is no evidence that humans can catch the virus from animals. It is possible that a pet's fur could become contaminated if an infected person has previously touched or stroked that animal. But even with the threat of coronavirus, you should always wash your hands with soap and water after handling an animal or its lead and avoid touching your nose and mouth. What is the risk to children? In general, children appear to be relatively unaffected by the coronavirus according to data from China and other countries. This may be because they are able to shake off the infection or have no symptoms or only very mild ones similar to a cold. However, children with underlying lung problems such as asthma may have to be more careful. Work issues. The next topic is called work issues. I'm self-employed. Can I claim benefits if I can't work due to the virus? Self-employed people who have symptoms or have been told to self-isolate may apply for 2 benefits: universal credit, or employment, and support allowance. Normally, you will be eligible after 4 days of being ill. However, the government has responded to the spread of coronavirus by saying that companies will temporarily pay SSP from the first day off, but charities are worried that there is still a 5-week delay before universal credit is paid. Who is eligible for universal credit? Anyone aged 18 or above can apply for universal credit if they live in the UK or are on a low income and out of work. Students in full-time education aren't usually eligible for universal credit, but they can make a claim if they do not have any parental support, are responsible for a child, or in a couple with a partner who is eligible for universal credit. People aged 16 or 17 can also apply for universal credit if they do not have any parental support, are responsible for a child, or caring for a disabled person who cannot work. You can find the government's benefits calculator to find out how much you may be entitled to. If you have to self-isolate, will you only get statutory sick pay, or will your employer pay your salary? The government advises that people who are self-isolating should work from home whenever possible and be paid as normal. If they can't work from home, employers must ensure any self-isolating employee gets sick pay or is allowed to use pay leave days if they prefer. Employees in self-isolation are entitled to statutory sick pay for every day they are in isolation, which is worth £95.85 per week as long as they qualify. However, employees can choose to pay staff their full wages during this period if they wish. What are my chances of getting a job in lockdown/when lockdown is over? Research conducted by the Resolution Foundation has found that coronavirus pandemic could increase youth unemployment by 600,000 this year. If you are worried about finding a job, you can head to the National Careers Service for advice on how to find job vacancies. You can also search online for virtual job fairs. This could help you explore different job opportunities and connect with potential employers directly from home. Experts recommend using lockdown to refresh your CV and also look for any online training opportunities which might put you in a better position when you eventually apply for a job. The next section is called Testing, Tracking and Tracing. How will people who don't have a mobile phone be able to submit they have symptoms? People experiencing symptoms will be asked to report this as soon as possible and order a test. You can do this via the NHS website, or if you do not have access to the internet, you can dial 119 in England, Wales and Northern Ireland, or 0800 9 sorry about this. 0800 282816 in Scotland. I'm going to repeat that. 0800282816, which is 0800282816 in Scotland. Sorry about that. If you have been exposed to someone who has tested positive, you may be contacted by text message, email or phone. The government did have plans for a tracing app which would work on a smartphone, but these have been put back until winter at the earliest. The next section is called Quarantine. Can I travel to Ireland and then on to another country, then back to the UK via Ireland to avoid the quarantine? The short answer to this is no. It's true that you don't have to go into quarantine if you're returning to the UK from what's known as a Common Travel Area, a CTA, Ireland, Isle of Wight, Isle of Man and the Channel Islands. When the government first announced its plans, there was some speculation that to avoid quarantine, travellers from other countries would be able to fly into an airport in the CTA and then on to the UK and so avoid having to self-isolate. However, this loophole, termed by some the Dublin Dodge, have now been closed by the government. Travellers will only be exempt from quarantine if they have been in the CTA for 14 days or more. You will have to show proof of when you entered the CTA and how long you spent there, such as a boarding pass or itinerary, or when you enter the UK. And also, to be honest, it's about the safety. It's not just about avoiding the quarantine. The quarantine's obviously there for a reason, so please do quarantine if you have been in a country that's at high risk from coronavirus. It's totally worth it. Do key workers have to quarantine? Key workers will not necessarily be exempt. The government has published a detailed list of who will not need to follow the quarantine rules. Among others, it includes road haulage and freight workers, medical and care professionals providing essential healthcare, some seasonal agricultural workers, Eurostar and Eurotunnel employees, pilots and aircrew, and people working to maintain key infrastructure such as railways. It also depends where you are going in the UK. Some employees will be exempt from quarantine in England or Wales, but not Scotland. The government guidance details what you'll need to show when you enter the UK to prove you are exempt. This differs between categories, but typically includes proof of your name and address, the name of your employer, and what you'll be doing. Will my flatmates have to quarantine as well because of me? Unless your flatmates were travelling with you, they do not need to self-isolate or quarantine with you. However, you must avoid contact with them and minimise the time you spend in shared spaces like kitchens, bathrooms and sitting areas. You should stay well within a ventilated room. You should stay in a well-ventilated room with a window to the outside that can be opened. Separate from your flatmates, and if you can, you should use a separate bathroom from them. If you do need to share these facilities, regular cleaning will be required after each person has used them. Make sure you use separate towels from the others in your house, both for bathing and showering, and for washing your hands. If I have to quarantine after a holiday and can't work from home, will I get paid? Not necessarily. If you have returned from holiday abroad and have to self-isolate and quarantine, you will not automatically qualify for statutory sick pay, the SSP. So it's possible you might have to take the extra time off as annual leave or else as unpaid leave. The Government of Work and Pensions says that anyone planning to travel should do so in the knowledge that they will be required to self-isolate on their return. It adds that employees and staff should discuss and agree any arrangements in advance, and urges employers to take socially responsible decisions. Meanwhile, the Foreign and Commonwealth Office is still advising UK nationals against taking all but essential international travel. The next section is called Support Bubbles. When will people be allowed to resume physical contact with a loved one in a bubble scenario? If you and your boyfriend both live alone in England or girlfriend, you can form a support bubble, which means that you can spend as much time as you want in each other's company, inside or outside the house. You don't have to keep a 2-metre distance from one another, and you can stay overnight at each other's house. If you are living alone and your partner is in a shared household or vice versa, matters get complicated. Sorry about that. You can still form a support bubble with your boyfriend or girlfriend, but it will also be with his or her household, and it would be the only bubble allowed to that household. What that means is that if one of your boyfriends or girlfriend's housemates has a partner who is, like you, living elsewhere and alone, the couple will be prevented from meeting up. Support bubbles are for the benefit of people who are living alone or alone with children. If both you and your boyfriend are living in shared households, you are not allowed to form one, and you are restricted to meeting outdoors and at a distance of 2 metres from one another. Northern Ireland has introduced support bubbles, while Scotland and Wales now allow a similar arrangement known as extended households. In all of these, if one person taking part develops symptoms, every member of the bubble or extended household must self-isolate. If I have to quarantine after a holiday, is that it? No, this is the final question. If I have to quarantine after a holiday and can't work from home, if I have to quarantine after a holiday and can't work from home, will I get paid? Not necessarily. If you have returned from holiday abroad and have to self-isolate and quarantine, you will not automatically qualify for statutory sick pay, SSP. So it's possible you might have to take the extra time off as annual leave, or else as unpaid leave. The Department of Work and Pensions says that anyone planning to travel should do so in the knowledge that they will be required to self-isolate on their return. It adds that employers and staff should discuss and agree any arrangements in advance, and urges employers to take socially responsible decisions. Meanwhile, the Foreign and Commonwealth Office is still advising UK nationals against taking all but essential international travel. There is one more section. Support bubbles. When will people be allowed to resume physical contact with a loved one in a bubble scenario? If you and your boyfriend or girlfriend both live alone and in England, you can form a support bubble, as we were talking about before, which means that you can spend as much time as you want in each other's company, inside or outside a house. You don't have to keep a 2-metre distance from one another, and you can stay overnight at each other's house. If you are living alone and your partner is in a shared household, or vice versa, matters get complicated. You can still form a support bubble with your boyfriend or girlfriend, but it will also be with his or her household, and it would be the only bubble prevented in that household. This is very similar to the one before, but I'm just going to carry on reading it. So prevents their partner from meeting up as well. We kind of already know that. So I think some of these are getting quite repetitive. But here's the last one. I don't think this should overlap. Can I have my grandson overnight? I am a single grandparent living on the ground floor in my own house. However, I have a lodger who lives on the second floor. If you're in England and you're a single grandparent, you have the right to form a support bubble with your grandson and his family. Under the government's guidance, your grandson is able to stay at home, including overnight, and you will not need to keep a 2-metre distance. However, the complicating factor here is your lodger. Are you maintaining a 2-metre distance from one another, and are you using separate rooms and facilities? If the answer is yes, then that should be no problem. On the other hand, if you have been using the same kitchen, living room and bathroom, and eating from the same crockery and cutlery as your lodger, then you're both effectively part of the same household and you do not qualify to be part of the support bubble. So that's it. I know this was a long video, but I hope it was very informative and I've answered as many of your questions as possible. If you did enjoy the video, please do leave a like and subscribe, and leave any other questions in the comments, and we will answer them as quickly as possible. Please do also leave any suggestions in the comments. Once again, thank you very much for watching the video. I hope you enjoyed it, and please stay safe.